Hello everyone, now let us discuss about 2023 changes in the coding guidelines for cognitive assessment and care plan services. This comes under the evaluation and management chapter of CPT. Coming to cognitive assessment and care plan services, they are provided when a comprehensive evaluation of a new or existing patient. When a comprehensive evaluation of a new or existing patient who exhibits the signs and or symptoms of the cognitive impairment is required to establish or confirm a diagnosis, etiology and severity of the condition. And this service includes a thorough evaluation of medical and psychosocial factors potentially contributing to increased morbidity. And do not report cognitive assessment and care plan services if any of the required elements are not performed. You have a list of elements that are required to be performed under the code, and if any of the required elements are not performed or are deemed unnecessary for the patient conditions, we should not report the cognitive assessment and care plan services. For these services, see the appropriate E&M code. And a single physician or other qualified healthcare professional should not report 99483, which is a CPT for cognitive assessment and care plan service. They should not report 99483 more than once for every 180 days. More than once for every 180 days within 6 months. That is, within 6 months you cannot code twice 99483. They should not report 99483 more than once for every 180 days. And services for cognitive assessment and care plan include a cognitive relevant history as well as assessment of the factors that could be contributing to the cognitive impairment, including but not limited to psychoactive medication, chronic pain syndromes, infection, depression and other brain diseases. For example, tumor, stroke, normal pressure, hydrocephalus, etc. And medical decision making includes current and likely progression of the disease. It includes the current and the likely progression of the disease, assessing the need for referral for rehabilitative, social, legal, financial or community-based services, meal transportation and other personal assistance services. Medical decision making will take into account the current and likely progression of the disease, and it assesses the need for the referral for rehabilitative, social, legal, financial or community-based services, meal transportation and other personal assistance services. All these things are taken into consideration while in the MDM. Now coming to the code 99483. This code has been revised, hence it is indicated by this triangle. So the description of 99483 is assessment of and care plan for a patient with cognitive impairment requiring an independent historian in the office or other outpatient, home or domiciliary or restroom with all the following required elements. It can be done in home or office outpatient or home visit also. The required elements are cognition focused evaluation including a pertinent history and examination, medical decision making of moderate or high complexity. MDM must be moderate or high. Next is functional assessment. For example, basic and instrumental activities of daily living, including decision making capacity. Use of standardized instrument for staging of dementia. For example, functional assessment staging test, FAST, and clinical dementia rating, CDR. These staging scales must be reported. Medication reconciliation and review for high-risk medications. Evaluation of neuropsychiatric and behavioral symptoms, including depression, including the use of standardized screening instrument. Evaluation of safety, for example, home, including motor vehicle operation. Identification of caregiver, caregiver's knowledge, caregiver needs, social supports, and the willingness of the caregiver to take on caregiving tasks. Then the development, updating of revision or review of an advanced care plan. Creation of a written care plan, including the initial plans to address any neuropsychiatric symptoms, neurocognitive symptoms, functional limitations, and referral to the community resources as needed. For example, rehabilitation services, adult day programs, support resources as needed, support groups, shares with the patient and or caregiver with initial education and support. These are the elements that must be covered in order to code 99483. And the revision in this year is typically 60 minutes of total time is spent on the date of encounter. It requires typically 60 minutes of total time that is spent on the date of encounter. Previously, it was typically 50 minutes are spent face to face with the patient and or family or caregiver. Now it is 60 minutes of total time, not simply face to face time. 60 minutes of total time spent on the day of encounter. And for services of 75 minutes or longer, you need to use the code 99417. One more important point is do not report this cognitive assessment and care plan services with E&M services, outpatient, new patient or established patient, consultation services. In all these outpatient services, you should not code home or resident services. You should not code with the other E&M services. Now let us see an example. Mrs. Smith was seen in the office for assessment, treatment and care planning. Mrs. Smith was seen in the office for assessment, treatment and care planning for worsening dementia and the patient's activities of daily life become affected, such as bill paying, cooking, cleaning and traveling. And the fast longitudinal view shows the patient is in stage 4. Here the patient is suffering from dementia and she is in the stage 4 of fast scale. And the patient's activities of daily living are affected, such as bill paying, cooking, cleaning and traveling, and is seen for the assessment, treatment and care planning for worsening dementia. Here the chronic condition is worsening, so this contributes to moderate MDM. And the medications are also reviewed and the patient was educated for the medication complaints. So the appropriate CPT here is 99483. Assessment and or care planning for a patient with cognitive impairment requiring an independent historian in the office or other outpatient, home or domiciliary or restroom services. The total time spent in the visit is 62 minutes. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.